The authentication servers were collapsing in real time. On the main screen in Meridian Pharmaceutical's operations center, cascading red alerts flooded the display like blood pooling across a white floor. Clinical trial data portals locked out. Drug formulation databases timing out. Regulatory compliance systems throwing errors that nobody understood. The stock ticker in the corner showed a number that made grown executives feel physically ill, down 40% and still falling. "Get someone on this now!" Carter Bennett's voice cracked across the room, his usual corporate composure shattered into something raw and desperate. Priya Sharma was already on her phone, fingers trembling as she scrolled through contacts. "I'm trying to reach the validation team. They're saying they need authorization codes that..." "Then get the authorization codes." Dr. Hayes had them. The name dropped into the chaos, like a stone into still water. For 3 seconds, the operations center went silent, except for the relentless beeping of failing systems. 3 days ago, Dr. Arya Hayes had walked out of this building carrying a cardboard box and a smile that nobody had understood. Now, they understood it perfectly. Before we go further, make sure you hit that subscribe button and turn on notifications. You won't want to miss what happens next. The story actually started 3 years earlier, when Dr. Arya Hayes walked into Meridian Pharmaceuticals with hope in her chest and a signed contract in her hand. The VP of Research Operations, Marcus Frost, had sold her a vision during her interview: a complete data integrity overhaul, a dedicated team of validation specialists and compliance officers, resources to build something that actually mattered. "We're investing heavily in our regulatory compliance posture," Marcus had said, his smile polished to a corporate shine. "You'll have everything you need." What Arya got instead was a cubicle, a laptop, and the growing realization that she was the entire validation and compliance team for a multi-billion-dollar pharmaceutical company racing toward FDA approval on 3 different drug candidates. The budget cuts came quietly, like water rising around an island. First, the 3 promised hires became 2. Then, those 2 became, "We'll revisit this next quarter." Then next quarter became next year. Meanwhile, Arya found herself holding together regulatory systems that should have had 15 people monitoring them. She built automated validation protocols at 2 a.m. when everyone else had gone home. She wrote standard operating procedures that nobody read. She submitted staffing proposals that vanished into the void of corporate bureaucracy like messages in bottles thrown into an endless ocean. "Dr. Hayes, you're doing amazing work," Marcus told her during a performance review, his voice warm with the kind of praise that costs nothing. "Really, the board is impressed. Then, can we talk about hiring?" "Let's table that for now. You're handling things so well on your own." His smile never wavered. "We'll definitely revisit it next quarter." Arya had heard that phrase so many times it had become white noise. The breaking point should have come 6 months before she left, when she caught a critical flaw in Meridian's clinical trial data management system. She'd been running routine validation checks, something nobody had asked her to do but that needed doing anyway, when she noticed data integrity patterns that made her blood run cold. Someone's automated system was introducing microscopic errors into trial datasets. Nothing obvious enough to flag immediately, but significant enough to potentially invalidate years of research and FDA submissions. Arya spent 72 hours straight tracing the error, patching the validation protocols, and implementing additional monitoring. She stopped what would have been a catastrophic regulatory failure. She saved the company hundreds of millions, possibly billions, in potential FDA penalties and lost drug approvals. The reward came 2 weeks later. A $500 gift card to a restaurant she'd never heard of, and a mention buried at the bottom of the corporate newsletter, misspelling her last name. "This is what we're worth to them," she'd said to herself, sitting alone at her desk at midnight, the fluorescent lights buzzing overhead like insects trapped in glass. "This is what they think we deserve." She didn't want applause. She didn't want her name on buildings or awards on walls. She wanted a team. She wanted someone to share the crushing weight of being a single point of failure in a system that could collapse at any moment. But Meridian had made its choice, and that choice was to squeeze every ounce of value from Dr. Aria Hayes while giving back as little as possible. The Pharmaceutical Compliance Conference in Chicago happened in early March. Aria had requested travel approval for months, but when Meridian finally agreed to pay her registration, they claimed the hotel budget had been allocated elsewhere. "Can you stay with family?" Marcus had suggested, as if that were a perfectly reasonable ask. So Aria slept on her friend's couch and took the train to the convention center each morning, while Meridian executives stayed at the Ritz-Carlton and expensed steaks she couldn't afford. That's where she met Dr. Sienna Cross. Aria was standing in front of a presentation on adaptive trial validation frameworks, scribbling notes, when a voice beside her said, "The speaker's model looks great on slides, but would collapse under actual FDA scrutiny." Aria turned to find a woman about her age. Auburn hair pulled back, eyes sharp with intelligence, and something else recognition maybe. Like seeing yourself in a mirror you didn't know existed. "You noticed the data integrity bottleneck too?" Aria asked. "Hard to miss if you've actually built these systems, instead of just talking about them." Sienna extended her hand. Dr. Sienna Cross, head of regulatory affairs at Helix Biosystems. They got coffee, then lunch, then dinner that stretched into hours of conversation that felt like therapy and strategy session combined. "Let me guess," Sienna said over her second glass of wine. "You're the only one holding your company's compliance together?" Aria laughed, but it came out bitter. "How'd you know?" "Because I've seen this story 100 times. Brilliant validation specialist, terrible company, zero support, maximum expectations." Sienna leaned forward. "Can I ask you something without it being weird?" "Sure. Would you be interested in weekend consulting work? Advisory stuff? Protocol reviews? Nothing that would touch active trials or create conflicts. We're growing fast, and I could use someone with your brain." Aria hesitated. The ethical line seemed clear enough: advisory work, different company, completely separate from her day job. But something about it felt like standing at the edge of a cliff. "What's the rate?" she asked. Sienna named a number that made Aria's wine glass freeze halfway to her mouth. It was more than she made at Meridian in 2 weeks. "I'd need to think about it." "Of course, no pressure." Sienna slid across a business card. "But Aria, you're better than how they're treating you. You know that, right?" Aria kept that card in her pocket for 3 days before she called. The double life started small. Saturday mornings at a Helix Biosystems office that actually had natural light, working with validation specialists who asked her opinion and then revolutionary concept actually listened. They built compliance frameworks together. They argued about regulatory strategy in ways that made Aria feel alive instead of exhausted. Sienna had a whole team, but she treated Aria like a colleague, not a resource to be extracted and discarded. "What do you think about structuring the validation protocol here?" Sienna would ask, pointing at trial designs spread across a conference table. "I think if we do it wrong, we risk the entire FDA submission," Aria would respond, and then they'd spend 2 hours figuring out how to do it right. Meanwhile, Meridian continued to crumble in slow motion. Aria submitted another staffing proposal. Ignored. She flagged capacity issues in their data validation infrastructure. Ignored. She warned about documentation drift in their standard operating procedures. Ignored. "We trust your judgment," Marcus told her in a hallway conversation that lasted 30 seconds. "Just keep doing what you're doing." What she was doing was preventing regulatory disaster through sheer force of will and institutional knowledge that existed nowhere but in her head. The worst part? She'd tried to document everything. She'd written validation manuals and compliance runbooks and quality assurance guides, but Meridian had never given her time to formalize them, never allocated resources to build proper documentation systems, never cared about anything beyond the immediate crisis. "Deal with the fire in front of us," Marcus had said more than once. "We'll worry about prevention later." Later never came. The discovery happened on a Tuesday. Arya had been entering Helix Biosystems building for a routine Saturday session when Owen Mitchell, a Meridian project manager she vaguely knew, happened to be walking past. He'd been visiting a colleague in the area. Pure coincidence, but his eyes went wide when he saw her. By Wednesday morning, Arya was sitting in a conference room with Marcus and two people from HR she'd never met. "We need to discuss a potential violation of company policy," the HR director said, her voice carrying the careful neutrality of someone delivering bad news they'd rehearsed. Marcus leaned back in his chair, arms crossed, his usual warmth replaced with something cold and satisfied. "You've been working for a competitor." "I've been doing weekend advisory consulting," Arya corrected. "Protocol review, no access to active trials, completely separate from my work here. No conflict of interest." "That's not your determination to make," Marcus said. "You signed a non-compete and outside engagement policy." Arya had read those documents. The advisory exception clearly states, "We've consulted with legal. Your engagement with Helix Biosystems violates the spirit of your employment agreement." Marcus's smile was thin and sharp. "We're terminating your employment effective immediately." Arya felt something inside her chest go very still and very quiet. "You're firing me." "We're ending a relationship that you chose to compromise," Marcus said. "We'll need your badge, your laptop, your access cards. Security will escort you out." Arya didn't argue, didn't plead. She calmly placed her badge on the table, powered down her laptop, and handed over the security cards that had given her access to every critical system in Meridian Pharmaceutical's infrastructure. "You'll need the documentation," she said quietly. Marcus waved a hand. "We have your files." "No," Arya said, standing. "You have the files I managed to write in between crises. The real knowledge, the validations I performed manually, the workarounds I implemented, the institutional knowledge that kept this place compliant that was never documented because you never gave me time to document it." Something flickered across Marcus's face. Uncertainty, maybe. Fear, probably. But his pride won. "We'll manage." Arya walked out of Meridian Pharmaceuticals, carrying a cardboard box with a coffee mug and a plant. She didn't look back. She didn't need to. Behind her, in laboratories and data centers she would never see again, her absence was already beginning to spread like cracks in a windshield. The collapse started small. 72 hours after Arya's departure, a routine database migration triggered a validation conflict she would have caught in 30 seconds. Instead, it cascaded into a data integrity failure that nobody noticed until clinical trial submissions started getting rejected. "Just roll back the migration," someone suggested. They rolled back the migration, which triggered a failover protocol that Arya had manually patched 6 months ago, but never had time to properly fix because Meridian was always fighting immediate fires instead of preventing future ones. The failover crashed into a compliance system that contained a single bad configuration, one parameter that Arya had been planning to correct but hadn't gotten to yet because she was, after all, just one person holding together systems that needed 15. The compliance failure caused regulatory reports to generate with corrupted timestamps. Those reports went to the FDA, which triggered an immediate investigation, which locked down 3 separate drug approval processes. By hour 6, Meridian Pharmaceutical's operations center looked like a war room losing the war. Executives shouted into phones. Validation specialists stared at screens showing errors they didn't understand. Someone suggested calling in an outside consultant, but nobody could agree on who. "Get Dr. Hayes on the phone," Carter Bennett finally said, his voice hoarse from yelling. "She won't answer," Priya Sharma replied, holding up her phone with 10 unanswered calls. "Offer her whatever she wants." They tried. They called, they emailed, they even sent someone to her apartment building. Dr. Aria Hayes, for the first time in 3 years, was completely unavailable to Meridian Pharmaceuticals. Because she was in a conference room at Helix Biosystems, calmly discussing her new role as Principal Regulatory Architect. "We want you to build what you always wanted to build," Sienna said, sliding a contract across the table. "Full team, real budget, equity stake, and Aria, you'll never be a single point of failure here. We're going to document everything, cross-train everyone, and build systems that can outlive any one person." Aria looked at the salary number. Triple what Meridian had paid her. "When do I start?" The media picked up the story on day 3. "Meridian Pharmaceuticals suffers massive compliance failure," ran on Biopharma Today. "Major drug companies' systems collapse after firing key regulatory specialist," followed on Forbes. The stock price, already damaged, went into freefall. Meridian's PR team made a catastrophic mistake. They tried to blame Aria publicly. Former employee violated company policy and left critical systems vulnerable. Their statement read, "Helix Biosystems' legal team, which included lawyers who'd been waiting for a case exactly like this, tore that statement into confetti. Our consultant followed all applicable regulations and ethical guidelines," their response began, before systematically dismantling every claim Meridian had made. "The failure at Meridian Pharmaceuticals stems from years of systematic underinvestment in regulatory infrastructure and the exploitation of a single employee to mask institutional negligence." The follow-up articles were even worse for Meridian. How one pharma company lost 40% market value by ignoring regulatory compliance. The hidden cost of treating your validation team like a cost center. Meridian Pharmaceuticals, a case study in corporate negligence. If you're enjoying this story of corporate karma, go ahead and drop a like and let me know in the comments. Have you ever seen a company collapse because they pushed someone out? Meanwhile, Aria was building something beautiful. Her first week at Helix Biosystems, Sienna introduced her to her new team. 8 regulatory specialists and validation experts, each one brilliant, each one eager to collaborate instead of compete. "This is Dr. Aria Hayes," Sienna told them. "She's going to lead our regulatory compliance division. Learn from her, challenge her, and for the love of everything, document what you learn." They worked together on a validation framework that Aria had dreamed about for years, but never had resources to build. They created redundancy where it mattered, documentation that actually helped, and systems that wouldn't collapse if any one person left. Documentation isn't bureaucracy. Aria told her team during their first all-hands meeting. "It's survival. It's the difference between a system that depends on heroes and a system that doesn't need them." She taught them everything. Not because she had to, but because she finally could. The contrast was stark and savage. While Helix Biosystems' team collaborated over whiteboards and coffee, Meridian Pharmaceuticals' remaining specialists scrambled through video calls that devolved into blame sessions. "Why didn't anyone know about the validation protocol issue?" someone would ask. "Dr. Hayes handled that." "Well, where's the documentation?" "Dr. Hayes was supposed to document it." "Did anyone ask Dr. Hayes to document it?" Silence. Marcus Frost, notably, stopped appearing in company meetings. By week 3, Meridian stabilized enough to stop hemorrhaging FDA applications, but the damage was existential. Major partnership contracts canceled. 3 drug approvals delayed indefinitely. Regulatory investigations opened. The board demanded answers that executives couldn't provide without admitting they'd built their entire compliance infrastructure on the back of one person they then fired out of spite. That's when Meridian made its desperate play. The email came to Aria's new Helix Biosystems address, marked urgent, sent from Meridian's CEO directly. "We need your expertise. Name your terms." Aria read it 3 times, showed it to Sienna. "What do you want to do?" Sienna asked. Aria thought about it for exactly 1 day. Then she wrote her response. Her terms were specific and non-negotiable. $40,000 per hour. 4-hour minimum paid up front. Remote consultation only. She would never step foot in their building again. Meridian would issue a formal public apology for their previous statement. They would either rehire or financially compensate every staff member laid off during the crisis. And finally, they would implement the complete regulatory team structure Arya had proposed 2 years ago, the one Marcus had called excessive and unnecessary. "This is insane," Priya Sharma said when she saw the terms. "Pay it," the board chair replied, "and count ourselves lucky she's willing to help at all." Meridian paid. The consultation happened over screen share. Arya's calm voice walking shell-shocked Meridian specialists through fixes that seemed obvious once explained, but had been invisible before. "Your validation protocol has a circular dependency here," she'd say, highlighting code. "See how this parameter references itself? That's causing the cascading failure. Fix it like this." She worked for exactly 4 hours. She didn't gloat, didn't lecture, didn't make anyone feel small. She simply fixed what was broken and explained how to prevent it from breaking again. At the end, she said, "You need to hire a full regulatory team, not next quarter, now. One person can't do this job, and you should never have expected anyone to try." Then, she logged off, closed her laptop, and went to lunch with her Helix Biosystems team. Marcus Frost was quietly removed from his position 3 days later. Carter Bennett and Priya Sharma faced disciplinary reviews that ended with demotions. The board brought in an entirely new executive team, whose first priority was rebuilding what should have existed all along. But the damage was permanent. Meridian Pharmaceuticals lost 30% of its partnership pipeline. Industry trust, once broken, doesn't repair easily. Companies that had relied on Meridian for decades quietly migrated to competitors. Competitors like Helix Biosystems, whose regulatory compliance infrastructure suddenly looked very attractive to nervous pharmaceutical partners. "We're getting 3 new partnership inquiries per day," Sienna told Arya during a strategy meeting, "all of them specifically asking about our validation and compliance approach, all of them citing the Meridian situation as a reason they're switching." Arya had an idea. What if we built a consulting arm, not full regulatory management, but compliance architecture advisory, helping companies avoid becoming the next Meridian? Sienna smiled. "Write me a proposal." Arya did. It was comprehensive, realistic, and based on years of knowing exactly what pharmaceutical companies did wrong. Helix Biosystems board approved it unanimously. Within 6 months, Arya's consulting division was generating 7 figures in revenue and turning away clients. The Pharmaceutical Compliance Conference came around again the following March. Arya had been asked to give a keynote speech, something about resilient regulatory architecture, though the conference organizers had privately admitted they really wanted her to talk about Meridian. She stood backstage, watching the crowd file in. Industry veterans, former colleagues, specialists who'd once ignored her warnings and now hung on her every word. And there, in the 3rd row, Dr. Sienna Cross smiled up at her with the pride of someone who'd always known this moment would come. Arya saw Dr. Garrett Quinn in the audience, a former Meridian colleague who'd been kind but never quite kind enough to push back when it mattered. Their eyes met. He looked away first. She took the stage to applause that felt like vindication and victory and something deeper recognition, finally, for work that had always deserved it. "Systems don't fail because of science," Arya said, her voice carrying across the conference hall. "They fail because people don't listen. They fail because companies treat their safety nets like cost centers. They fail because someone, somewhere, decided that short-term savings mattered more than long-term stability." She talked about single points of failure, about institutional knowledge, about the difference between treating people like resources versus treating them like humans. "If your pharmaceutical company would collapse without one specific person," she finished, "you don't have a system, you have a time bomb. Build better, treat your people better, document everything, and for the love of everything, hire a real team." The applause was long and loud and genuine. That evening, Arya found herself on a rooftop bar with her Helix Biosystems team, city lights spreading below them like stars reflected in water. They laughed about terrible validation frameworks they'd fixed, toasted to successful FDA submissions, and planned the next quarter's initiatives. Sienna raised her glass. To Arya, who showed us all what happens when talent meets terrible management. To teams, Arya corrected, clinking glasses. And to never being a single point of failure again. Her phone buzzed. Another Meridian specialist reaching out to ask about job opportunities at Helix Biosystems. She smiled and pocketed the phone. That conversation could wait until tomorrow. For tonight, she was exactly where she deserved to be. Surrounded by people who valued her, doing work that mattered, building systems that would outlast any one person's contribution. Her revenge had never been Meridian Pharmaceuticals' collapse, though she wouldn't pretend that hadn't been satisfying. Her revenge was simpler and more profound. It was building something better. And that, as it turned out, was the best revenge of all. If this story resonated with you, make sure to subscribe for more stories about people who fought back against impossible odds and won. Drop a comment about your own work experiences. I read every one. And hit that like button if you think Arya's story needed to be told. Thanks for watching, and I'll see you in the next one.